Hi.
Hi.
Good afternoon. Go ahead and sit down.
Sure.
I'm Bella Robinson. I'm going to be your student nurse this afternoon to perform your head-to-toe assessment.
Okay.
So you can first just say your name and date of birth for me.
Sure. Lauren Massey, 5/21/99.
All right. And how old does that make you, Lauren?
19.
Are you currently a student?
I am.
What are you studying?
Nursing.
That's awesome. Are you a commuter or do you live on campus?
I live on campus.
Okay. So you must eat the cafeteria a lot. How's the food?
It's good.
All right. So I'm just going to perform head-to-toe assessment. So I'm just going to start at your head and work my way down.
Okay.
Does anything bring you in today?
No. Just a general checkup.
Okay. Any concerns for me?
No.
Do you have any pain today?
No.
So on a scale of 0 to 10, 10 being the worst, how would you rate your pain?
0.
Okay. So first I'm just going to take your hands. Flip them over for me. Good. Check the capillary refill. Okay. So now I'm going to go to your head. Do you have any bumps or lesions you want me to watch out for?
No.
Okay. Good. Do you wear glasses?
I do.
Okay. Nearsighted, farsighted?
Both.
Okay. So I'm just going to look straight, and I'm going to go ahead and dilate your eyes so it's going to be bright light, okay? Good. And one more time. Good. I'm going to come to this side. Good. And one more time. Good. Do you go to frequent eye checkups? Okay. So next I'm just going to do a little treat at me without moving your head, just your eyes, follow my finger. Good. So I'll go ahead and cover that eye up, your right eye. Perfect. So now I'm just going to ask you to see when you see my finger.
I can see it.
Want to look this side?
I can see it.
Good. And switch sides. Same thing. When can you see it?
I can see it.
Good. And look this side.
I can see it.
Good. So now I should close your eyes and I'm going to apply resistance and I'm not going to let you open them.
Okay.
Good. Can you raise your eyebrows for me and shrink them? There we go. And let me see that big smile with teeth. Good. Frown. Puff those cheeks. Good. I'm just going to let the ear out. Do you have any trouble hearing or anything?
Nope.
Can you hear this?
Yes.
What about this?
Yes.
Okay, good. Any trouble chewing? Any pain?
Nope.
I'm going to go ahead and feel your jaw.
Mm-hmm.
Go ahead and clench those teeth for me. Good. Don't let me open. Good. Now I'm just going to apply some resistance. You can try to go. Good. Now this way. Good. So now I'm going to go ahead and just take a look inside your mouth.
Okay.
Any lesions or sores in your mouth you want me to
Nope.
be careful of? Okay. Good. All right. I'm going to ask you to open up wide and say ah. Good. I'm going to go ahead and just take a look. Good. Go ahead and lift your tongue up and down, to the side, other side. Good. So I'm going to go ahead and ask you to say light, tight, dynamite.
Light, tight, dynamite.
Good. All right. I'm going to keep moving my way down.
Okay.
So I'm going to go to your neck. Do you have any pain or tenderness?
Nope.
Do you have any difficulty swallowing?
Nope.
Go ahead and find your carotid. Okay. Nice and strong. I'm going to do this side. Good, both equal and strong. Right. So you said no pain or anything?
No.
All right. I'm going to go ahead and take a listen.
Okay.
I'm going to have you do a couple of range of motion exercises with your neck. So can you go ahead and look down for me? And then look up, and to the right, to the left, Any pain with any of that?
No.
Can you go ahead and take your ear and touch it to your shoulder? Good. Now the other way. Good. All right. Now I'm gonna have you go turn right around. I'm gonna inspect your back.
Okay.
Lauren, do you have a cough or shortness of breath at all?
No.
All right. So right now I'm just taking a look. I'm gonna go ahead and just palpate. Okay.
Okay.
If anything hurts, just let me know.
Okay.
All right. I'm gonna go ahead and put my hands underneath your rib cage, and you go ahead and take a big deep breath for me. Good. Okay. And now when I place my hand on your back, can you say 99?
Sure. 99, 99, 99, 99,
Just gonna lift this up.
99, 99.
Good. Now I'm gonna do some percussions, which is gonna be tapping with my finger, okay?
Okay.
Start up here. Go. How are you doing? You okay?
Yep.
Okay. I'll go ahead and just raise this up. Good. I'm gonna go ahead and take a listen on your back.
Okay.
When you feel my stethoscope, just go ahead and take a big deep breath with your mouth open, please.
Okay.
Good. How are you doing?
Good.
Any shortness of breath or dizziness?
No.
Okay, if you get like that, just let me know.
Okay.
Good. All right, I'm gonna have you go and turn right back over to the front.
Okay.
I'm gonna do the same thing. I'm just gonna do it on your front side.
Okay.
Do you have any chest pain at all?
No.
Okay, I'm gonna go ahead and just feel. Tell me if there's any pain. Do you do regular self breast exams?
Yes.
Good. It's very important. All right, so I'm gonna do the same thing. I'm gonna take my hands underneath your rib cage and ask you to take a big deep breath. Good. So I'm gonna do some tapping with my finger. Okay, almost forgot, but I'm gonna do place my hand on your chest and just ask you to say 99.
Sure. 99, 99, 99, 99,
Let's put this up.
99, 99.
Good. All right, so now I'm gonna go ahead and take a listen on the front side.
Sure.
Take a big deep breath for me. All right, so now I'm just gonna have you go ahead and lay down.
Sure.
I'm gonna have you go ahead and look this way. Go ahead now towards me. Any pain now that you're laying down?
No.
Okay, just feel across again. Go ahead and take a look. All right, just gonna go ahead and find your apical pulse. Good. Now I'm gonna take a listen to your heart. I'm gonna listen in different couple areas.
Okay.
So it might take me a minute, but don't be concerned, okay?
Okay.
Alright, so now at this part of the apical, I'm gonna listen for a full minute, so just relax.
Okay.
So now I'm gonna go ahead and just keep listening down to your abdomen, okay?
Okay.
Now I'm just gonna feel around.
Okay.
I'm gonna start off lightly, but if there's any pain, just let me know. I'm gonna go a little deeper, okay?
Okay.
Now I'm just gonna do a tapping on your stomach, okay?
Okay.
Okay. Now I'm gonna work my way down to the legs. Do you have any pain or any cramps?
No.
All right, so I'm gonna go ahead and have you bend this knee. I'm gonna go ahead and find your popliteal pulse. I'm having trouble finding it, but that's completely normal.
Okay.
I'm gonna try this one, and if I can't, I'm gonna grab the Doppler, okay? Good. I'm just gonna pull these socks down.
Okay.
Good, both sides are strong and equal. I'm gonna go ahead down here. Again, both strong and equal. Pull these socks up. All right, and now I'm gonna go ahead and apply some resistance and see how strong these are. Good. Now this way. Good. All right, so now I'm gonna do some range of motion exercises with your leg.
Okay.
So I'm just gonna ask you to bring this leg as high as you can, okay? Good. Now the other one. Good. And now go ahead and bend this leg to your chest. Good. Now that leg to your chest. Good. Now I'm gonna go ahead and push down, apply some resistance. Try to lift up. Good. Nice and strong. So now I'm gonna ask you to sit up. And I'm gonna do the same thing with your upper extremities, your arms.
Okay.
So I'm just gonna ask you to do some arm circles. Good. And then can you take both your hands and touch it behind your back? And go ahead and put your arms straight out. And then push down. Push up. And over here, I'm just gonna have you take your heel and touch it right up to your knee and straight down your shin to your ankle. Now the other one. Good. So now I'm gonna do sensation.
Okay.
All right. So this is gonna be the sharp side.
Okay.
And this is the dull.
Okay.
And when you feel it, just say if it's sharp or dull. Okay.
Okay. Sharp, dull, sharp, dull.
Good. Same thing, I'm gonna have you close your eyes.
Okay.
And when you feel this, I'm gonna have you say yes, okay?
Yes. 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 Yes.
Good. So I'm gonna have you do some coordination exercises.
Okay.
So I'm gonna go ahead and first have you take your index finger and touch your nose and then touch my finger. I'm gonna move my finger around. You're gonna go as fast as you can. Good. And now I'm gonna have you take your thumb and touch your index finger and then touch all your fingers to your pinky and back as fast as you can. Good. And now the other one. Good. And I'm gonna have you have your hands on your knees and I'm gonna have you turn them over, back and front as fast as you can. Good. All right, so now we're nearing the end of the exam. I'm gonna have you go ahead and stand up. And I'm gonna have you just walk a couple steps.
Okay.
Good. And on the way back, go ahead and walk heel to toe for me.
Okay.
And go ahead and walk on your tippy toes now. And your heels. Perfect. I'm standing right over here. I'm just gonna do the same with your feet together, arms by your side.
Okay.
I'm gonna have you close your eyes and just stand like that for a couple seconds. Good. Go ahead and open. And now I'm just gonna have you do a balance test. I'm gonna have you stand on one leg and bend down and just do a little bit of a squat. Good. Other leg. Good. So Lauren, that concludes the end of our head to toe assessment this afternoon. Do you have any questions or concerns?
No.
All right. Well, it was great meeting you.
Nice meeting you.
Have a good afternoon.
Thank you.